So, a huge problem that many disabled people face is how to get from A to B for appointments and for the job, for education and stuff. And if their car is wrecked, it can really mess with their lives. And when you're disabled, you have less ability to make money oftentimes. You have less ability to plan ahead. Planning stuff makes you more stressed out oftentimes, and so on and so on, which really can negatively affect a person when the car is hurt, and they also have less money. So here are some ideas. Also, disabled people might not do as well in public transportation or transportation with many people, because of executive dysfunction can make it really hard to plan these trips out. They might not be up to it, sometimes with sickness going on and off, and the people and sensory things, the noise, can all really get to someone. So here are some ideas to kind of work around that. One is, and I apologize for this thing blocking the way, is car insurance for the disabled, with insurance being a little hidden. And that is, in case something does happen for a disabled person, they have car insurance by the government or something that is guaranteed and cheaper for them, kind of like an extra benefit, so they can also afford it more, because car insurance is a huge cost. And so when it does break down, they can get repaired more likely and with a faster thing. Now, is it perfect? No. Now, we also have to make sure that car insurance is easy to use, because a lot of disabled people have difficulties with bureaucracy and stuff like that, communication and stuff like that. Now, making the car insurance would also save the government maybe money in the long run, because then we'll be healthier, so less payments in health funds. They could be more productive and stuff like that. So I think this program would pay for itself. But the priority should always be the person, not money. And the next one is to maybe invent cheaper, better, good cars. Some of them might be subsidized for disabled people. Now, disabled people do have different requirements, such as wheelchair users and stuff like that, the non-disabled person for getting in and out of a car. So you have to take that into account with accessibility. A lot of, also, it's not something that people really research, making cars for disabled people, especially big companies, because they're more likely to be poor and they're not a big market. So trying to maybe force companies to really look into making more cars that have more disability access and make those cars more affordable could be a huge part. And again, maybe we will even subsidize some of these cars and stuff like that. Huge thing. And the third option is better public transportation. Now, I do not think public transportation is the perfect solution, but it's a solution to some of us in some cases. The problem with public transportation for disabled people is you have to schedule everything correctly, which can be a big burden. There can be a lot of people that are just plain nasty, mean to you, get in your way. It can increase your chance of getting sick and risk if you're immunocompromised, and all these other ones. For some people, they get less anxious with public transportation because they have anxiety driving. For some people that can't drive, it is a good option at times, and it can be cheaper. We also have to look at how making public transportation more accommodating for many different types of people, such as making it more wheelchair accessible, or crutches, figuring out how to make the system more on time, having it ways that it's less noisy, having clearer signs and stuff, keeping it cleaner, a bunch of little things. And also maybe with disabled people, we can make a program to make it cheaper for them, which there already exist some of these programs, but I'm saying making them better and more, and it's also highly dependent on where you live. Not only country, but also city and county and everything. And it depends on your disability too. Also, we could train people in better public etiquette to help them be more accommodating to the general public. Another idea is that if someone doesn't have a car access immediately but needs a car access, get like a taxi, Uber, or something system for disabled people. But now you could try to subsidize it by the government, but then the problem is that whenever they try to subsidize private companies without strict profit control, they usually raise up the prices. But if you had a government Uber system that's mostly designed for disabled people, in the long run, then they could help transport a lot of them across, but not only for groceries and other things, and help them gain independence in many ways, and agency and freedom, and make appointments. So that's just an idea, and I would imagine that in the long run, making a whole Uber taxi system run by the government for everyone would be a great idea, because it might reduce emissions. I'm talking about for everyone. You might be able to better plan it on such a large scale, but also it could give a lot of people jobs. And if you make it so the government runs it right, you can make the pay a good, fair pay. Unlike previous programs, which usually do not give the very best payout. Another idea along this line is to design home visits of doctors and more professionals. And those home visits means that they don't have to plan going out or anything like that at all in the first place. Or visits, or if it's not home visits, maybe a visit that's more local, like a local center, so your doctor comes from 100 miles away to a local center. That's another thing I forgot to mention, is that many, if you have a disability and you might have finding a good doctor can be really hard, or specialist or programs. So you might have people that you need to visit that are 50 to over 100 miles away in various directions. So that can also be a huge barrier why they need good transportation. But getting them to be able to get a little closer back and forth could be a huge, huge, huge help in some cases. Another idea along these lines is more online visits and more online way of doing stuff. I'm talking about everything from shopping to doctor visits, stuff, and we can have more home testing kits for weight, for height, we're starting to get ones that you can examine your own throat or ears, on stuff like that. And the advantage of home visits and online stuff is also a person's much more less likely to be anxious if they're in the house and they don't have to prepare going out with dressing and stuff like that as much. So that can be a huge benefit and just help them calm down and make it more flexible when they're not feeling well. And we're also getting a lot more tests that now included becoming available just to do in your house, so you won't have to go to a doctor to get a test done. Of course, there's a problem with a home test if is the person doing it fully right, or they exaggerating or under-exaggerating results. Little problems there, but I don't think they're major. Another thing is to break up big hospitals into more small centers and hospitals located everywhere, or food banks or grocery places and stuff like that. So you don't have to travel as far. Now this might reduce accidents because you're not 100 miles, you're less likely to get into an accident than if you're only driving 10 miles. It's probably easier to find someone to help drive you that distance. You can get there in a much shorter notice. It's not a whole trip planning. You might even be able to, if you have trouble with public transportation, you might be able to better suck it up for public transportation, and so on. If you're using an Uber or a taxi system, you're less likely to get sick if you have less exposure. So all these benefits of having stuff more local and smaller. Also, if something bad happens in a center town, if it's small and more local, that's not as big of a problem. So that is an idea elsewhere, but I would think the government needs to step in, because the consensus so far is now to conglomerate and make bigger and bigger centers for profit reasons, because they're oftentimes cheaper for big organizations to run. Also, this bureaucracy and tendency just for stuff to overgrow and be big and advertising and stuff, even if it doesn't make a profit sense. Another idea is just to make the roads safer, so there's less accidents in the first place. If we can get less cars on the road by using better public transportation, more online stuff, making cities more walkable, just changing our culture, that all helps right there. If we have better traffic lights, that includes smart traffic lights that use complicated sensors, that includes traffic lights that are clear and easier to see, that includes better road signs and stuff, then less accidents there. We could have better training for people. So with driving, because some driver's ed are ridiculously bad. The driver's ed where I grew up, the written test was all about blood alcohol levels, which, yes, not being drunk is important, but you can't measure your own blood alcohol. And then there's like stuff like that, and like vertical driver's license versus a horizontal driver's license, which is where I grew up in Virginia. If you're under 21 when you got your driver's license is kind of sideways, so your picture it's vertical, with your head's thing up straight. If you have it going up and down your thing, compared to when you're over, it's horizontal, which doesn't help you really drive at all. And the driver's ed wasn't very good, so better training, and we have some of the most accidents in Virginia where I grew up. Better roads, so I've talked before, but there's roads that could let water away faster, could give you better grip, could make it be easier to see at night. You could also design smart cars, which are cars that, I'm talking from simple to super futuristic, but cars that help prevent accidents as much, with better navigation systems, with maybe smart windows that help you see where you're driving to stay in the right lane, that warn you of stuff. Or maybe cars with better visibility, cars that are less prone to hurting you if you get in an accident. But also maybe it's this changing car culture, so people buy safer cars in the first place, not the sporty cars that are not always the safest. And sporty cars also make people try to drive faster and more dangerously than if they're driving a mom van, which is one of the few people I like more mom vans than normal vans. Another thing that would help is having flexible schedules, so that if you miss your appointment, you can more easily go to a place later on or before, depending on when the stuff happens, or doctors willing to see you at different times, which would probably mean more people in the workforce or better scheduling practices or stuff like that. Or if you can do some of the visits partly elsewhere and partly at the place. So if you do your basic first doctor visit online or something, then you do go to a place, you can make your visit small from 1 hour to like 10 minutes. And that means that if you only have a 10-minute trip, it's easier they can be more flexible, because they don't have to find an hour block for you. They just have 10 minutes block. If you mix the 10-minute block, they can move you around more easily. This makes all planning a lot more easier for both ends. And they can probably offer more times and stuff for you. Another idea is to combine trips together. Now, combining trips together could be wonderful in many ways, but that also requires more planning. And that would, if we figure out better ways of doing it though, it'll take less resources to deliver disabled people back and forth. Now, the problem with combining trips is that, what if you have immunocompromised or have an illness and you don't want to spread it? What if you have sensory issues with a lot of people? And also anxiety of planning stuff. So that's not a perfect solution by any means. Another idea along this line is to invent more durable cars. And so when they're in an accident, they are more easily repaired, or maybe better, more repairable cars. Here's a huge problem with what I just said though. When a car is that durability usually makes a car less safe. So you really have to balance it, because like you need a crumple zone to take in some impact. Now, with combined trips, I also mean like combining groceries trips of some other people, if you have people delivering groceries and stuff. You can also try to figure out more ride-sharing ideas, which I'm listening as slightly different than combining trips, where you have a person that shares a car with you to make it cheaper. So I may sort of said car sharing, like Zipcars, or the community owns a car, or stuff like that, or like you have a designated driver, stuff like that. Another idea along these lines is to rent cheaper cars or subsidized cars for doctors or stuff to make such visits at home or to travel all around, so they travel to you more easily and cheaper than the other way around, and making a whole system like that. Now, something that's the last thing, which is way, way, way in the future, would be to have drones that drive you instead of you driving yourself and drive other people. eVTOLs, which are electric aircrafts that can vertically take off and take you eVTOL stands for electrical VT, vertical take off, sorry, VTO, and lifts, or other ways like that are just very futuristic with automated travels. I just put that out there. I think it's something we should work on, but I think it's still like 20 or so more years down the line. Well, thank you very much for listening. Please like and subscribe who helps the channel out. I'm trying to reach 1,000 subscribers in a year and 4,000 watch hours, which is really hard. With your help, I think I can do it. Also, if any ideas for future videos, comments, or suggestions, please leave them in the comment section below. Again, thank you very much. Goodbye.